Dysbarism is basically defined as the changes in the pressure of the environment, and it can be the pressures that are caused due to the air, or it can be pressures that are caused due to the water in the environment. So it can be a diving phenomena, as well as it can be a mounting phenomena that can be the cause of the changes in the pressure in the environment that can prove to be fatal in a lot of conditions. So we are talking about the barotrauma. This dysbarism can prove to be fatal or traumatic for particular individuals. What is the underlying pathology, and what basically happens, that has already been discussed, and we are going to basically move on with the discussion over here in this section. So basically, we are going to discuss the autopsy in a particular case of dysbarism, in which dysbarism was the cause of death and barotrauma occurred. Now, barotrauma basically occurs due to the shear pressures and due to the overstretching of the skin that occurs after the dysbarism phenomena. So we'll discuss that over here. The external findings are again very important over here. The internal examination is also again very important over here, and we are going to discuss that even over here in detail. So the histological findings, the routine tissue samples, that is the liver, the brain, the kidneys, the heart, that is sent to the histopathologist. And the findings, the particular findings are the endothelium damage that is seen, and there is ischemic injury found in these tissues, in these vital organs, that leads to the death in individuals that are subjected to such dysbarism. So prior to autopsy, basically, that is conducted in a decompression chamber, and the bubble formation is again very important, and the photography and radiology of the head, neck, chest, and abdomen before dissection. And even before performing all of these things, the external examinations that are being carried out, one has to be quite vigilant, and the forensic practitioner who is carrying out the investigation has to visit the crime scene himself or herself if it is possible. Just to have an overview of the environment, of the predators that can be present in a particular diving scenario, even they have to be taken into account. So all of these can basically lead to the death in a particular person. So it's again very important. Photography of the person before you place your knife on that person for the autopsy procedure. You have to take the radiographs, you have to have the photographs of the individual in detail. Chemical analysis is again another phenomena that has to be taken into account over here. Moving on, the external findings have to be looked for. The skin color, the color of the hypostasis, that has to be emphasized over here in detail, whether it is a cherry red discoloration or whether it is a pinkish discoloration, or it is a bluish discoloration. It is of high significance over here that we emphasize on these facts. Then we also taken into account the temperatures. So we can we'll take the rectal temperatures if it's possible. And we have to basically distinguish the death, whether it was a post-mortem drowning phenomena or whether it was an ante-mortem drowning phenomena. They have their own specificities, and we'll discuss them over here. So the bright pink discoloration is seen in a particular case. The external findings are looked for. There is a characteristic rash in these cases of dysbarism. Now, this rash is basically named as the cutis marmorata on the thighs and the torso. This is a particular rash that is seen on the thoracic region or on the torso of the person, and it is of particular significance over here. The red linear marks, they are again very important, and they have to be looked for. These are the external findings that have to be looked for and emphasized in a particular case. Now, the crepitance of the skin. So it is basically the emphysema, even the traumatic emphysema that occurred, and there are air bubbles under the skin, and it has to be felt for. It basically gives you a crepitated feeling when you touch the skin of such a person who is suffering from emphysema. So the eardrums are examined with an otoscope to detect the recent ruptures, because as it was already emphasized, the skin basically goes an overextension, and the eardrums can be damaged or traumatized, and the middle ear infections can be found, or even it can be ruptured. The tympanic membrane can be ruptured after such a barotrauma has been observed. They remove basically, first of all, when you are considering the brain is removed before opening the body cavities, and the artery forceps are placed on the middle cerebral, the basilar, and the vertebral arteries. So these are the arteries that we have to look for, and we have to look for the signs of the damage to the endothelium. And again, we have to look for the signs of the ischemic injury that is observed in these vital organs. The brain is then placed under water, and the clamps are removed to observe whether the air bubbles escape from the cut ends of the vessels or not. So that is basically going to show whether there were any pressure changes in the surrounding, and they're going to indicate that there was a dysbaric phenomena that occurred and that basically damaged the brain. So the central nervous system is examined in detail over here. The petechial hemorrhages are looked for, and the eye infarcts are the mainstay over here. These petechial hemorrhages, basically, they can occur due to the masks that are put on the eyes during the diving phenomena, and that is also going to change the pressures in the surroundings. Histologically, ring-shaped hemorrhages are found around the vessels or around the vessel area. It's again very important over here. Now, in long-term survivors, the softening of the lateral and the dorsal columns of the thoracic spinal cords are noted in a lot of cases. So they can be observed. The central nervous system and even the vital tissues of all the organs are sent to the histopathologist, and they are examined in detail, and their histological assays are dealt in with detail before writing down an autopsy report and giving a final verdict. Now, the lungs and the chest are also looked for. As you can see over here, it's a normal bronchiole and an alveoli. And over here, it's a bullous formation, that is after the emphysematous reaction. So the subcutaneous, mediastinal, retroperitoneal, or subpleural emphysema are the important features over here. There can be the rupture of the alveolar membranes noted down. Pneumothorax is one of the factors that come into play. It's basically the air in the thoracic cavity. That is one of the complications of the dysbarism. Pleural adhesions are also taken into account, and that basically gives you an idea whether an infectious state was dealt with after the dysbaric changes or not. The intercostal space is punctured. If there is a tension pneumothorax, or if there is a pneumothorax and there are pleural adhesions as well, what are the treatment modalities that you have to look for if the person is living? That is, you have to basically puncture the intercostal space. And even while performing an autopsy on a dead person, basically you're going to puncture the intercostal space and get the fluid samples and send them to the histopathologist. The heart and the lungs are also radiologically examined, and they're looked for any signs of damage as well. Histological examination gives you a complete detailed account on the lipid-containing tissues, microbubbles with a foamy appearance. This is basically an emphysematic lung that is taken into account in the histology or in the slides. Fatty change in the liver is also looked for. The lungs give you an edematous, patchy hemorrhages, torn alveoli, and focal emphysema. So the myocardium is looked for small foci of necrosis as well. Fat embolism may occur after this, and the cellular bone marrow is found in the target organs. So these are the histological findings that will be found in the particular barotrauma. So in this section, basically, we dealt with how are we going to carry out investigations in a particular death that was caused due to barotrauma, and how an autopsy is carried out in this particular case. That is the end of this section. Thank you for watching sqadia.com.